This video outlines how to utilize the 6-finger knot pusher to tie arthroscopic knots in shoulder surgery. The authors have disclosures which are visible on this slide. The 6-finger knot pusher has three components: the nitinol loop with its black handle, which is used to thread the post limb of the suture in the inner metal sheath. There is an outer plastic sheath, which is used to push the throws of the non-post limb into the shoulder. The knots tied with the 6-finger are a surgeon's knot. This is 3 underhand throws backed up with alternating half hitches for a total of 6 throws. Step 1 is to identify which limb is going to be the post limb and thread it through the metal sheath of the nitinol loop. The post limb is usually on the soft tissue in a simple suture configuration. For mattress suture configurations, the surgeon may choose either limb to be the post. Step 2 is to throw an underhand loop and use the plastic outer sheath to push this loop into the shoulder. Push the loop off the end of the metal inner sheath. Step 3 is to tension this loop to the appropriate amount of tension. This is done by wrapping the end of the suture around your little and ring finger on the right hand and using the index and thumb finger of the right hand to push down on the metal sheath, providing counter tension. Step 4 is to throw another underhand loop and pass it into the shoulder using the plastic outer sheath. Push this loop over the end of the metal sheath, pass point, and then retension the post limb. Repeat step 4 to create your third underhand loop and pass this into the shoulder, pass pointing and tensioning the knot. Step 5 involves passing another loop. This can be done either as an underhand throw and flipping the post, as shown here, or as an overhand throw. To flip the post, release tension on the post limb and apply tension on the non-post limb. Use the metal inner sheath to pass point and tighten the loop. The knot has 4 throws so far, 3 in one direction and 1 in another direction. Repeat step 4 to throw another underhand throw and pass point to tension this loop onto the knot stack. The final and 6th throw is an underhand loop with a flip post or an overhand throw. Make sure to pass point once this loop is pushed onto the knot stack. The arthroscopic surgeon's knot is now complete. A key learning point is to ensure that each loop is aligned to the metal sheath before pushing it onto the knot stack. This is done by rotating the outer and inner sheath using the handles in the direction to remove the twist of the non-post limb. Another key learning point relates to flipping the post. This is done by switching the tension from the post limb to the non-post limb and using the metal sheath to pass point once the post is flipped. Finally, here are some examples of the 6-finger being used in arthroscopic shoulder surgery. On the top right, we can see a large rotator cuff tear being repaired using a medialized single row technique to avoid excessive tension on the tissue. In the bottom right, we can see a revision posterior labral repair with poor quality tissue. The 6-finger allows for tactile and visual feedback to avoid strangulating this friable capsulolabral tissue. On the bottom left, we can see a human dermal allograft patch being secured with simple sutures on the native supraspinatus tendon edge in this massive irreparable cuff tear. The 6-finger is able to manipulate the graft into position whilst tying the knots. In the top left, we can see a labral repair being performed using a knotted technique after a distal tibial allograft reconstruction of the glenoid for bone loss. A knotted repair is used here as the tissue needs to come over the graft and the surgeon should minimize risk of the suture cheese wiring through the capsulolabral tissue. Hence, tactile feedback is necessary. Thank you for watching this video.